What does informed consent for Vyvanse, otherwise known as lisdexamfetamine, look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot in this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So Vyvanse is a stimulant. It is a long-acting version of the amphetamine type of stimulant. So shorter acting versions include things like Adderall. So like other amphetamine-based derivatives, it's a little bit more powerful than the methylphenidates, things like Ritalin or Concerta, because of its mechanism of action. It's FDA approved for ADHD, of course, but it's also FDA approved for binge eating disorder. I typically think about starting this medication in adults who have a new diagnosis of ADHD, or maybe they're coming back to treatment after they haven't had any ADHD treatment for some time. Because usually when we think about first-line treatment for adults, we do think about the amphetamine-based stimulants rather than methylphenidates. I prefer to start with the long-acting. So something like Vyvanse, which has one of the longest-acting half-lives of all the stimulants, is a really good option. So its duration of action lasts about 10 to 14 hours. So it's going to last for most people a full work day or school day. Side effects are going to be similar to those that can be experienced with any stimulant. So that's going to include things like anxiety, agitation. There can be mood swings, decrease in appetite, insomnia. There's going to be an increase in your heart rate and blood pressure. So this medication can potentially be dangerous for those who have a significant cardiac history, or not safe for those who have poorly controlled high blood pressure. If you have a family history of sudden cardiac death or a personal history of significant cardiac issues, then it's important to get clearance from either your primary care provider and or your cardiologist to make sure that it's safe for you to take this type of medication. And sometimes this medication can cause palpitations. If that's the case, it's definitely important to get a workup from your primary or cardiologist. Make sure you get an EKG to ensure that there's nothing else dangerous going on. Sometimes it can also cause things like stomach upset, headache, diarrhea, and sometimes it can just really make people feel wired, and they may not like that feeling. Additionally, sometimes as the effect of the medication is wearing off, people can get really irritable and cranky. Stimulants are some of our most effective medications in psychiatry, so typically you try one and there's an 80% efficacy rate. If that doesn't work, you try another. There's a 90% chance that you'll respond to one or both. One of the nice things about stimulants is that you really only need to take them as needed, meaning that it's not something you have to take every day to get the effect of. You can take it when you have a long day at work or when you need to focus, and you can skip it on the weekends or when you're on vacation. And in fact, I do recommend doing that because that can help to reduce tolerance. So tolerance is when you need higher and higher doses of a medication to get the same therapeutic effect. So this can certainly happen with stimulants over time. And so it's important to try to mitigate that by minimizing your exposure as much as possible. Additionally, because it is so short acting, it's only gonna be affecting you for the hours that it's in your system. So both the positive effects as well as the side effects. So if you try it, you don't like it, you just don't take it again, and you're not going to have those issues persisting. Additionally, they're a lot easier to get off of. I can't say that there's no withdrawal symptom, but it's usually pretty time limited. Within 48 hours, I would expect that syndrome to have passed. And that's going to look like basically the opposite of the effect of the medication. Things like feeling drowsy, low energy, excessive sleeping. Sometimes you can feel a little depressed. One of the things to note about stimulants is that since the pandemic, there's been a shortage of them. So this can certainly be a challenge. At times it's been Vyvanse, at times it's been Concerta. So I've certainly had to work with patients to find a pharmacy that has access to the stimulant that they're prescribed, or will switch it up to make sure that they have something on board, even if they can't take their preferred stimulant. So that is a potential issue with a lot of the stimulants. We're working on getting longer term data from the stimulants. A recent study did show that people who have ADHD and are treated with stimulants are less likely to develop dementia than those who are not. There's just a lot we don't know. So after going through all this, we would talk about whether the potential benefits of this medication outweigh the risks for that individual, and we would make a shared decision from there. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then put it in the comments below. I'm also putting together an email list for those of you who are interested in my content, because I may have future courses or offerings, and I want to be able to communicate directly with you all about those things. So if that's you, send me a DM with your email, and I'll see you in the next one.